Other things that you will need at home, apart from what you have packed in your hospital bags, other basic things that you will need, as I've mentioned before, you need diapers, you need wipes, you need nappy bags, because if you go out and you need to maybe your baby used a nappy and you need to pack that, you need to put that in a bag. You don't want to just throw a soy nappy in your handbag or your baby bag like that. So you need a nappy bag to put that before putting it in your bag and then going back home to dispose. You need your baby toiletries, bathing bowl, the bath. There's this baby bath that we use back home in Nigeria. You can buy it here. They sell it here in different shops. Asda, I don't know. I don't think Sainsbury's sells, but I know Asda sells it, and you can even buy online. A lot of these things you can buy them online. You don't have to stress yourself going to shops. But if you want to get it cheaper, you might want to check in shops. You might want to check in charity places. You might want to check where they are doing sales around you, so you don't buy them expensive. So you need a baby bath, you need a baby soap, baby sponge, all those things that you also need for yourself. The baby also needs them. Baby cream, baby comb, nail cutter. Their nails grow very fast. So you need a nail cutter and, of course, nappies and their clothes. So you need clothes. You need baby socks, baby hats, gloves, depending on the weather. Gloves, if you are giving birth maybe around September, October, November, December, January, February, March, you need gloves. You need gloves. You need thick socks. You need jackets that the baby will wear whenever you are going out for an appointment. Even sometimes in the home, you need cardigan that the baby can put on. So you need all those things as part of the shopping you do for baby. And you don't have to buy all these things at once. These babies, they grow so fast. You can buy the first 3 months, you can buy the first 6 months. After that, you go back again and buy. But to buy the basic things like the jackets, you can buy just 2 of the jackets. You don't have to buy like 3 or 4 jackets, because once they put on clothes, they'll put on the jacket and that is it. And then you also need a baby cot. There will be an health visitor that will be assigned to you after you give birth. This person is the one that will be coming to check the baby on monthly basis, periodic basis as the baby grows. So one of the things your health visitor that is assigned to your home would check is where the baby is sleeping. You need to buy a baby cot. There are different baby cots online that you can buy. I prefer to buy the one that they can use up to like 3-4 years old, even though some babies will not even sleep in whichever one you get. So, but you still need to get it, because after some time you might transfer them to the cot, even if they are sleeping on the main bed. But your health visitor would want to see a very safe place for the baby to sleep, and not on your bed. A separate place for the baby to sleep, but probably in your room. Some people have separate room for their babies, but most people have the baby cots in their main room, but definitely different from where they also sleep. You also would need a baby carrier or a pushchair, depending on what you want. I love baby carriers because it makes life easier for me. I use baby carrier when I go for school runs. I use baby carrier within the house when I need to do something and I need to keep the baby is so maybe attached to me. I use the carrier. It helps a lot and it's very cheap. So you might want to consider buying a carrier as well, or you want a pushchair so that you can take a walk around. If you are giving birth during summer where you can easily go out and enjoy the sunny weather, you need a pushchair so you can use it to push the baby. And you can even back your babies. When I newly came, there's so many things they talk about, so you can't back baby in the UK. I back my baby and I've not had anybody tell me that I can't. Back your baby as long as you strap the baby safely and properly. I don't think there's any problem. So if you are comfortable with putting your baby on the back, go for it. All the best. Other things you would want to get for the baby as the baby grows is a baby bouncer, so that you can keep the baby and you can do other things, maybe like reading or cooking while the baby watches you. Toys as the baby grows, then feeding things like baby plates and all those things, spoon. There are things that will come after. You don't have to buy them immediately. Then, as I've mentioned before, health visitors and midwives will visit you when you newly give birth. They will want to come and check the baby. They will want to come and weigh the baby. They will also want to come and check on you to know how you are feeling. And after some time, the midwife would discharge you and say the health visitor will continue to come and be weighing the baby monthly, and after 6 months she will not come again until after some months again. And also there will be immunization. Immunization is done on periodic basis, so there will be letters from your GP telling you to bring the baby for immunization at certain times. So you might just want to put that in your mind. You don't have to get worried if they don't tell you to come for immunization. They have the record, they know when it's the right time for the baby to get immunized. In terms of work, when you are pregnant and you newly moved to the UK, except you started working before you get pregnant, you can easily say, yes, I'm going on maternity leave, and you get maternity allowance. Even if your employer is not paying you, you still get some entitlement from maybe the government. But when you moved with pregnancy, if you are not showing too much, I'll say it's much easier for you to get your hand on something, to start working, if you are lucky. But if you are already showing, believe me, of course, nobody is allowed to discriminate. That is what is expected. But who would want to take a pregnant person, a pregnant person that is due maybe in another 3 months? Who would want to engage them? Aside the fact that there will be statutory benefits the employer needs to pay, one will also consider how agile the person that you are employing will be. So if you are pregnant and you have newly moved, I would say one of the things you should do is to chill, is to calm down. Calm down and have your baby. Calm down and enjoy all the time you can now. Calm down and have this time with your baby, because once you go back to work, you can't have the time back. The longest leave you will ever have as a woman is maternity leave. Take that. So, but if you started working and you have maternity and you are thinking, how about maternity leave? You have rights. You have right to maternity leave. You shouldn't say you want to work till the last day before you give birth. You don't have to stress yourself to that extent. Take your maternity leave. Tell them when you want to go back to work. You can, depending on the contract that you have with your employer, but you will get some payment, even if not directly from your employer, but from the government, as long as you've started the work like 15 weeks before your ADD. As long as you started the work before that time, which is a little bit weird, to be honest. After that, you can start looking forward to going back to work after spending some time at home, probably like 6 months, 9 months, 1 year, depending on what you want with your child. You can start thinking of going back to work. And one of the things you should put in mind is, once you made up your mind to go back to work with a child that is less than 3 years old, be ready to pay for childcare or have an alternative arrangement with your spouse if you have your spouse here with you, which means maybe somebody will work during the day and the other person stays with the baby, or you put your child in the nursery and you can now maybe go to work. Both of you can go to work. Apart from that, if you think it's not worth it, which is not really worth it, to be honest, the cost of childcare at this time is really not worth it. It's just too expensive. So only few people can afford it, with other bills that are coming up. So one of the things that people advise pregnant moms to do, or moms that just gives birth to baby that are not happy to go back to work because childcare is really more expensive probably than the work they are planning to go back to. One of the things they advise them to do is to contact other people around and see how you can help them babysit their children, or how you can help them pick their children from school. You know, childminder. See how you can do some courses on childminding, pending the time when your child will go and start school, and you won't have to be paying so much expensive for childcare. So that is another alternative. But for someone that's not good with children, you can't even suggest that. Other things you can do is to look for what you can sell, what business you can do in the environment that you found yourself. But if you still think, oh, I'll rather go to work, I'll rather go out and get something doing for myself, fine and good. Just weigh your options and see if you are not going to be adding more money to the childcare that you are paying in the name of working. Once you are doing your application for any job, if they ask why you have gap in your employment or what you have been doing that you are not working, you can tell them you are on maternity break or you are studying. So which means even while you are at home on maternity, while you are still waiting for your child to go a bit before you go back to job, you can pick up some short courses to improve your skills. You can do some online courses. You can go back to doing some professional exams. That gives you a good opportunity before you jump on another career. I hope you have picked one or two things from this video. Please follow me, subscribe to this channel, and like this video. I will be back for more content. Thank you so much for joining me. Bye.